Well, a warm welcome to today's update. It's Wednesday the 6th of October. I'm going to do a bit of orientation today from the UK, from the States, Australia and Canada, just to see where we're at, because we've been looking at other issues for the last couple of days and you actually lose track really quickly. So let's start off with the UK, and we've got some COVID symptom tracker app data, and basically we've got a high prevalence in the UK. Now, we had expected the numbers to go down a bit. Now, there was a risk that the numbers would go up in autumn, but we didn't expect them to stay high for as long as this. So this is taking everyone somewhat by surprise, really. Now, this is data for the end of September from the COVID symptom study app. It's based on nearly 40,000 recent swab tests between the 11th and 25th of September. So it's a bit dated, but it gives us a good idea of what's going on, but we will be bringing it bang up to date in a minute. Now, this is based on PCR and lateral flow tests. Now, these lateral flow tests are accurate, very, very accurate if they give a positive reading. They can often give false negatives, but if they give a positive reading, that basically means it's positive, although we do often confirm it with a PCR test, so I'm quite happy with that. Now, in the fully vaccinated population, over 14,000 people became symptomatic. So, vaccinated people, doubly vaccinated people, are clearly getting the infection. In the fully vaccinated population, over 14,000 new cases per day. But typically they were symptomatic for a shorter period of time with milder symptoms and less likely to be hospitalised, much less likely to be hospitalised and much less likely to die. But if we just look at that on this graph, it actually shows it here. So new cases in the UK on September the 25th. So this is a line for everyone. And these are the people that are fully vaccinated that are becoming infected, symptomatically infected. So we see it is quite a high number really that are still getting symptomatically infected. Not what we want, not what we wanted, but mostly they're not getting sick and not getting hospitalised. Overall prevalence in the UK, this is what I mean, remains really quite high. So 1 in 93 people in the UK have symptomatic COVID in the UK as a whole. The increasing numbers are mostly in the under 19s at the moment. Now, this is a bit of a trend. If we look at the data from Canada here, we see something very similar actually. So this is Canada as for the data from the 1st of October from Canada. And we see that the under 19s, which is this row here, by far the highest, well, the highest prevalence. And then in Canada it's going down, that's 20 to 29s. That's 30 to 39s there. We see it's going down with the ages pretty consistently in Canada. It's not quite at the higher age range, but that's the Canada position. So basically, there's lots and lots of young people around the world becoming infected at the moment, mostly with mild disease, thankfully, but not all, unfortunately. Now, going back to the UK data. Uptick in the number of active cases in people aged 20 to 50 as well. What's happening here is that children are coming home and infected their parents. So this sort of 40, 50-year-olds is the parents' generation of the children. Cases remain low and stable in the over 50s, contributors to the app over 50s. And the R overall, UK is around 1.1 for this period of time. Probably fairly similar now. England's 1.1, Wales 1.1, but it's increasing. Scotland slightly lower. So let's just look at a few more interesting graphics from this COVID symptom tracker data. Infection by age group. So as we see here clearly, it's the 0 to 19s that are increasing fastest. Then that green line there, is the 30 to 39, and the red line is the 40 to 49, as we've said. So and the lowest number there is the 60 plus, and that's the 50 to 59 line there. So children bringing the infection home to their parents' generation. This is the UK active cases. As we see, Wales is highest here, followed by the North East Yorkshire and the Humber and the other English regions. But the overall trend is similar-ish, although the Wales has taken off a bit in that time period. New cases of long COVID. Now, this is concerning. So every week, every day, there's hundreds of people developing long COVID. I'll give you a precise figure on that in a minute. But we see that the long COVID graph is basically mirroring the, albeit at a much lower level, of course, but it's mirroring the number of cases graphic. So long COVID is still quite an issue, really, all around the world, it has to be said. Now, this is the latest data here from the COVID Symptom Tracker app. So here we were looking at data from the end of September, but we actually see cases are slightly higher now. So that's the latest data there as of today, the 6th of October. 823,155 people currently symptomatic in the UK. So prevalence is still, no two ways about it, prevalence is still high. At this period of time, 804 people a day will go on to experience symptoms for longer than 12 weeks. And probably a third to a half of those could go on, maybe a third of those could go on having symptoms for much longer than that, potentially up to a year. So just a few quick conclusions from that before we go on to Canada and the United States. Tim Spector comments on this. We're seeing infections being passed up the generational ladder, likely from school children to their parents. That's what's happening at the moment. Most of these new infections are in the under 50s, which of course is the parents' generation of the children that are at school now, who still have a relatively low risk of being admitted to hospital, especially if they've been fully vaccinated, which is good. So hospitalisations aren't too high at the moment. As the winter approaches, it's important, this is quite an important point now, as the winter approaches, and this applies wherever you are, it's important parents of school-aged children and students don't pass the virus on to more vulnerable grandparents or other vulnerable people by not recognising simple cold-like symptoms as possible COVID. So the risk here is that children pass it on to their parents. The parents think they've got a cold, but they infect a more vulnerable grandparent or other more vulnerable person. So remember, these common cold type symptoms merit home testing at least now. It's a crucial time, and a little caution could make all the difference to avoiding a winter crisis for hospital, because we're not there yet. Cases could go up in winter, and that's the live feed there. Just a quick look to just look at the shape of that line there. Remember that. Then we'll go on to the official cases for the UK. Sorry, I didn't show you that, did I? My apologies. So that's the wavy line there for the COVID symptom tracker data. Let's look at the cases in the UK now, and we see it really is very similar. So this is actually reflecting the actual number of cases. So that's the official data. That's updated as of basically probably, as of today. So it's bang up to date, mirroring the COVID symptom tracker data quite accurately. Now, just quickly looking at healthcare, which is the thing we're concerned about. Now, hospital admissions are going down to levelling off slightly. People in hospital, well, it's been going down, but you'd have to say it's levelled off over the past few days in the UK. So and we've got autumn to come, and cases do seem to be increasing at the moment. Now, moving on to Canada now. So this is the site for Canada. Very good site, very well maintained site in Canada. Let's have a quick look at that. Going on to this screen. So here we have the situation in Canada. And we've got this useful map here. Now, this is the overall Canada situation. So we see that the cases, if you look at the graphic on the right-hand side of the screen, are actually levelling off at the moment. But then we can go through the Canadian province, and we actually see Northwest Territories, although a relatively small number of cases, it's increasing, as you see from the graphic. Not too bad in Yukon. Nunavut's remained low, which is good. British Columbia, levelish, slightly going down in Alberta. Saskatchewan slightly going down. Manitoba, lowish. Ontario and Quebec and Nova Scotia. So very useful graph in Canada there. And of course, if you look down, it gives you huge amounts of other data as well. So click on the link if you want more information on Canada. It's all there. Now, moving on to the United States. So cases in the United States, actually, this is United States, this is actually deaths. Let's look at cases first. So cases actually going down fairly well in the States as a whole. Deaths, well, yeah, it is starting to go down somewhat. But hospitalisations in the States are going down for the States as a whole, but this is still patchy. Now, the worst place at the moment seems to be Alaska, which, of course, did very well to begin with, but then is actually suffering quite badly now in terms of hospitalisation. So very well here earlier on, and things are looking hopeful, but the hospitalisations now are really quite stretched in Alaska. Hospitals, of course, being many hundreds of miles apart in Alaska, and there are quite significant local differences. So, but overall, the numbers in the States are sort of gradually going down, which is good. Although, of course, autumn's coming. So that's the deaths in the States, that's the hospitalisations. Look at the vaccine trends in the States if you want more information. Now, the White House. $1 billion for rapid at-home coronavirus testing has just been approved today, quadrupling the amount of tests available. Now, the testing in the United States, considering it's the United States, has been pretty poor, actually, with quite long queues for PCR testing. So many more lateral flow home tests now, many more lateral flow home tests becoming available. Up to 200 million per month. Now, what I don't know, if you're in the States, you could let me know this because I'm not really sure about this. What is the situation in the States for paying for tests? So in the UK, we get the lateral flow tests free at home. But I believe in the States, you still have to pay even for the home lateral flow test. So if someone could update me on the how you pay for tests in the States. I believe the PCR tests when you go into a unit are free, but they've got quite long waiting lists. So let me know about that, because it's hard to get that kind of detailed information from overseas. Now, this is data here from the Health and Human Services, I think it is. So we're going to look at that briefly now. Department of Health and Human Services, yeah. Now, they say that 265,000, this is that vaccines probably prevented in Medicare beneficiaries, which of course is a large chunk of the American population, in the first 5 months of this year. So Medicare recipients, beneficiaries, in the first 5 months of this year prevented over 250,000 infections, over 100,000 hospitalisations and 39,000 deaths is what they're claiming for vaccine efficacy in the States, which is good. But we are still getting people hospitalised and infected who've been vaccinated, although a lot more infections than hospitalisations and deaths, which is good because most of the infections are mild. But it's still not as good as we had hoped. We'd hoped for much more community immunity by now than this. Now, this next bit I want to talk about isn't science, and I kind of ummed and ahed whether to put it in a bit or not really, but I've decided to anyway, so make what you will of it. But apparently three founders of Moderna have made the Forbes list of Americans' richest during the pandemic. Now, this is good news for them, I suppose, but I'm not quite so sure it's such good news for the rest of us. Now, this list here is kept by Forbes publishers. 2.48 billion in research. So this is actually from a pharmacy magazine. 2.48 billion in research and development and supply funding from the US government went into Moderna. So the US government seemed to have paid for a lot of the development, but now a lot of people in Moderna are making substantial amounts of money. Don't quite know how that works out. So the US government paid for the development, and Moderna seems to be making a lot of money out of it. So if you understand how that works, do let me know. I'm being somewhat sarcastic there, of course. It just seems bizarre that the government's paid for all this money and yet doesn't seem to have a stake in its investment. It really seems. Did they just hand this money over? I don't know. But the list of 400 of the richest people in America, so 3 of them made them in. Now, this top 400, 40% richer than last year, so it takes much more to get in now than it did last year. And we do notice that the Oxford the Janssen Johnson & Johnson and the Oxford AstraZeneca vaccine have agreed not to make profits during the pandemic. But we know Pfizer and Moderna are making profits, so that might leave a pretty bad taste in quite a few people's mouths watching, as indeed it does in mine. Now, briefly, Australia. Now, what we're seeing in Australia is things are still pretty compartmentalised in Australia. So these are the active cases and the new cases in the last 24 hours, but Capital Territories is essentially part of New South Wales, so that kind of goes together. Very few, so no new cases in the Northern Territories, 2 in Queensland, 1 in South Australia, none in Tassie, and none in Western Australia, but Victoria, 523. So we still see that the outbreak is really restricted to New South Wales, Capital Territories and Victoria in Australia. And when we look at the graph for the Australia pandemic, it really is quite unique, really. So we had the first wave there with all those few cases, but of course they were greatly underdiagnosed at the time here. Then the second wave there, probably much more accurate then. And now we see the third wave after cases being so low for such a long period of time. It really is a pity, but this, of course, is all fueled by the Delta, by the Delta variant. Now, just briefly, a couple of other countries to look at. Poland. Poland has got really quite significant challenges in terms of healthcare provision. So it doesn't take a massive amount of cases to put healthcare provision under Poland at some strain, and there is the government said there's a red light flashing for Poland at the moment, and of course it's starting to get pretty cool over there now as we go into autumn. So fourth wave is gathering pace, cases up 70% on the week, health services stretched to the limits last spring where there was many more cases, but of course it doesn't take many doubling times to get back up to there as well. Let's hope the vaccination programme now has made the difference and the cases don't go anything like as high as they were in the more alpha variant phase. Deputy Health Minister in Poland, today's data was a fast flashing red light for Poland. Clearly worrying about doubling times. Let's hope we don't have a bad autumn. And Russia, well, I mean, what's going on in Russia? The Kremlin has confirmed another 25,000 cases in the day and another 929 deaths in the day. Bear in mind, this is what the Kremlin has confirmed, so whatever the real number is, we don't know, but we suspect strongly it's a lot higher than that. Likewise, the total of 208,842 deaths in Russia is going to be an absolute minimum estimate. So that's just a brief resume of where we are at the moment as we go into autumn. I still think that we're going to get more cases, hopefully not more hospitalisations, but more cases as we go into autumn. You could argue that's good because more people are going to get exposed to the natural virus, which we believe is going to give a much better immune boost. And I believe in places like the States and the UK and a lot of Western countries, things are going to be much better by early next year. I think this autumn is going to be the sort of last major problematic phase of this, at least of this Delta wave pandemic in terms of hospitalisations and deaths. And let's hope it's nothing like as bad after that. It's going to be with us for quite a few years. There's still going to be cases and deaths, but hopefully at a much lower level because we're going to have much more herd immunity. Other countries, of course, with lower vaccine rate, it's going to be a different story. It's going to go on there for at a higher rate potentially for quite a few years yet. So thanks you for that update. Tomorrow I'm planning on looking at toes.